I'm Paul Irwin, Dean of the School of Public Health here at UAB, and I want to welcome all of you to the annual State of the County address by the County Health Officer, Dr. Mark Wilson. Before I introduce Dr. Wilson, I want to do two more things. First of all, if you are an employee of the Jefferson County Department of Health, will you please stand? Thank you. You are our public health heroes, and we thank you for all that you have done for Jefferson County, for the state of Alabama in these 2 long years of COVID. Finally, let me express my appreciation to the school's Office of Public Health Practice, to Elena, Tessa, Sabrina, and Luke, to our PHSA volunteers, Riti and Naya, to Chrisima and Maria. Thank you very much for all that you're doing to support this. And now to Dr. Wilson. Dr. Wilson became health officer of Jefferson County, Alabama in 2011. Before taking this position, he served on the Jefferson County Board of Health for 3 years and worked for over 20 years as a general internist in indigent health care at the Cooper Green Mercy Hospital in Birmingham, including several years as outpatient medical director and then chief of staff. Dr. Wilson earned a Bachelor of Civil Engineering degree from Georgia Tech and his medical degree from the University of North Carolina, Chapel Hill. Since coming to the Jefferson County Department of Health and prior to the COVID-19 pandemic, his priorities have included advancing health equity, improving birth outcomes, addressing the drug addiction crisis, advocating for tobacco-free policy, supporting the development of a trails and greenway system to facilitate outdoor activity, and more recently, establishing a strategy to address violence as a public health priority. He has also worked to expand partnerships between the health department and other community organizations to pursue common goals related to public health. During the COVID-19 pandemic, he co-led the Jefferson County Unified Command Pandemic Response, along with the County Emergency Management Agency Director. On several occasions, he issued countywide public health orders and recommendations to help reduce community spread of the coronavirus. I think this is the 4th address, the 4th year that we've done this. And I can tell you that in these 2 years of the COVID pandemic, that Jefferson County has been in extremely good and capable, solid hands under Dr. Wilson's leadership. I'm honored to introduce him to you, Dr. Wilson.
Thank you, Dr. Irwin, for your very kind words, and thank you to the School of Public Health and UAB for your hospitality. Thank you, those of you that weathered the storm to be here in person, and thank the many of you that are on remotely for joining us today. This is a talk I give every year during Public Health Week, which is the first week in April of every year. Last year, I really focused mostly on the pandemic. And the year before that, we actually skipped it. That was April of 2020, when things were extremely intense in our pandemic response at that time. We just couldn't pull it off that year. But today I want to focus on a few non-COVID issues that have worsened or come into sharper focus during the pandemic, and perhaps to some extent because of the pandemic. Much of what we ordinarily do at the Jefferson County Department of Health had to be curtailed to some extent during the most intense surges of the pandemic. I'm happy to say that now all of our services are back up in full gear. You can see on this slide, it's a myriad of things that our health department does. I'll have to ask for forgiveness because I probably left a couple of things off. But I do want to take this opportunity to thank all the employees of the Jefferson County Department of Health for your dedication and for all the great work that you do to protect and promote health in our community. I'm extremely proud to be part of the good work that you all do. It's an honor to work with you. Thank you, and happy National Public Health Week. I do want to take just some time to reflect back on the pandemic and the tremendous amount of stress, loss, and pain that it caused. There have been over 6 million estimated deaths in the world so far from the pandemic, almost 1 million of those in the United States. More than 140,000 children have lost a parent or a caregiver to COVID. As of yesterday, Alabama had confirmed 19,334 COVID deaths. And you can see a significant number of these, over 2,600, occurred since the beginning of this year. And that's been especially tragic considering the majority of these were among people who were not vaccinated. And had they been vaccinated, many would have lived. In Jefferson County, so far, we've had, as of yesterday, 2,336 confirmed COVID deaths. That's a lot of people, a lot of loss. And a significant number of people, we don't really know how many, are suffering from long COVID symptoms, including recent evidence that many people are suffering some degree of brain injury from COVID. We don't really know what will happen going forward. I may refer to the pandemic some in past tense in this talk, but we just don't know. I think we still have more ahead, but it's anybody's guess. I will say, regardless of that, it's clear that we are going to have a lot of fallout from this pandemic for a long time. I will say some good things have happened too during the pandemic. Countless people in our community stepped up to help. We saw a tremendous amount of goodwill from our community. Old relationships with our partners in government, public health, healthcare, our educational institutions, our nonprofit sector were strengthened, and many new relationships were forged. I know that this has made us stronger and better prepared to face the challenges ahead, many of which I will talk about today. I'll also mention this, that one thing that we were very, very concerned with from the very beginning of this pandemic was health disparities based on race and ethnicity. The pandemic definitely put a spotlight on that. We were very worried about it from the very beginning, and we and our many partners went to great lengths to try to address disparities when it came to our COVID-19 response. This slide compares the COVID-related deaths by race to the racial breakdown of our population in Jefferson County. And you can see from this that it tracks pretty closely. The percentage of deaths is pretty close to the percentage represented in the population. So far, it looks like we may have done better than expected in terms of the expected disparities and outcomes from COVID-19 based on race and ethnicity. The rampant misinformation related to COVID-19 and especially COVID vaccines has cost a lot of lives. Anti-vaccination sentiment has gained traction, and I'm afraid that this is going to be going beyond just COVID-19 vaccines. Now, Alabama has enjoyed some of the highest childhood vaccination rates in the country, and that has helped protect us from outbreaks such as the measles outbreaks we had a few years in other parts of the country. But I'm very concerned about this and hope that we will remain vigilant so that we don't lose ground going forward. There's just a lot of anti-vaccine misinformation out there that we're concerned about. Many of the children in our community did get behind on their child immunizations in 2020 when the pandemic ramped up and a lot of energy was diverted towards pandemic response. In order to catch them up, our pediatrics department and social services department worked together and implemented a 2-week back to school vaccination clinic in July 2021 and accepted both scheduled and walk-in visits. In addition, there were 2 week-long special well child clinics in August 2020, also with scheduled and walk-in visits. As a result, JCDH had a 30% increase in well child and immunization visits compared to 2020, and an increase in the total childhood vaccination doses of 41% in 2021 compared to 2020. In recognition of this work, JCDH was one of 20 national winners of the Promoting Pediatric Primary Prevention Challenge given by the Health Resources and Services Administration's Maternal and Child Health Bureau. Another thing that the pandemic brought out was increased recognition that our country is in the midst of a mental health crisis. Just last week, the CDC reported that over 4 in 10 teens in the US reported persistent feelings of hopelessness and sadness in 2021. Some of this is being blamed on social isolation, loss, and stress from the pandemic and the pandemic response. But data trends actually show that this was already becoming a serious problem before the pandemic. You can see here that according to surveys conducted by the CDC each year, the percentage of youth reporting persistent feelings of hopelessness or sadness started increasing more dramatically beginning in 2017 and 18. The percentage of youth considering suicide or attempting suicide has been gradually increasing for over a decade. The silver lining, and I'll also just mention that in Jefferson County, you can see these numbers these are suicides by year, that basically these numbers, while we would all like them to be lower, they have been fairly stable. I would say that the silver lining here is that mental illness has become more recognized, more talked about, and less stigmatized during the pandemic. And it's getting more attention from our policymakers as well. For example, in the budget proposed by the Alabama legislature budget for next year, the Department of Mental Health is set to receive $193 million, a 16% increase over this year. And that will include funding to open more mental health crisis diversion centers in the state. Another big issue that continues to march on and plague our community is the addiction and overdose crisis. This slide, courtesy of the Jefferson County Coroner's and Medical Examiner's Office, shows the number of drug overdose deaths per year since the year 2000. And as you can see, the numbers were starting to level off prior to the pandemic and then skyrocketed during the pandemic. There are a number of reasons for this. Some of it is the stress of the pandemic itself, people having difficulty staying connected with their recovery community. Some of it has to do with the way the drug trafficking works across our borders and more fentanyl coming across our borders, which is much easier to smuggle because of its low volume compared to its potency. JCDH has continued to train people on overdose response and give out free overdose kits with naloxone or Narcan, the opioid antidote. This effort was greatly hampered by the pandemic initially. We were doing in-person trainings, which we had to curtail, until we got an administrative ruling from the Alabama Medical Board that allowed us to offer online training and then for registration for kits to be mailed out to people. This is what it looks like. You can go to the jcdh.org website and do an online training, watch a brief video, and then have a free kit mailed to you. And now anybody in the state of Alabama can go to our website and get this mailed to them anywhere in Alabama. In addition to this, we now have training. We have now trained and equipped almost all law enforcement agencies in Jefferson County and equipped them with Narcan. And we've made it available in some local emergency departments to give to patients after they've come in surviving an overdose or otherwise sought help for an opioid addiction. And you can see on this slide, as a result of this mail-out innovation, a tremendous increase in the amount of Narcan that we've been able to distribute in 2021. Just over half of this comes from the Alabama Department of Mental Health for law enforcement and for laypersons outside of Jefferson County. And then you can see just over 2,600 were actually provided by JCDH, purchased by our health department and given out in Jefferson County. You know, it does feel like we're losing the battle when it comes to overdose deaths. You can see the tremendous increase in numbers. But I just want to highlight a few examples of actual lives that were saved, and every life is very important. What we do is when people use a kit, they can contact our health department and report what happened and then get a replacement kit. So this is one of those messages. Today, my friend instantly overdosed after injecting a small amount of heroin. I administered Narcan. He wasn't breathing, so I did CPR. After a few minutes with no improvement, I administered a second dose and continued CPR. About 2 minutes later, he was gasping for air on his own. Thank you for the Narcan kit. I received it in the nick of time, or my best friend wouldn't be alive. I need a replacement as soon as possible. You may have seen this report in AL.com a few months ago. Jefferson County Sheriff Deputy resuscitated a 1-year-old girl that had accidentally ingested fentanyl, saved her life. There was also, I'll just mention a report from the mayor of Mountain Brook about 2 police officers that resuscitated a man found unresponsive in a grocery store bathroom. But there are many, many more of these testimonials, either laypersons, often saving the life of a loved one, and also police officers responding. I will mention, you know, our police, when we first introduced this idea, were very reluctant to do this, but now they're all in because they've had that experience of actually saving a life. So I do want to focus in on a little bit on the data on these overdose deaths in Jefferson County. And again, we have great reporting from our Jefferson County Coroner's Office that does very thorough toxicology on all suspected overdoses in Jefferson County. So we're very blessed to have them, along with the UAB Department of Pathology that provides a lot of their know-how. So we had 401 total overdose deaths in 2020. That was up from 302, in 2021, up from 302 in 2020. That was a 33% increase, and this is by far the highest we've ever seen. 343 of those involved opioids, 316 of those involved fentanyl, and there's some overlap in these, just so you know. There are people with multiple drugs in their system. 117 were people that had cocaine in their system, 68 involved heroin, and 134 involved methamphetamine. So we know that when we have these multiple drug overdose deaths, where you have fentanyl mixed maybe with cocaine, maybe with something else, that fentanyl by far and away is the most likely cause of death in most of these cases. So the bottom line is that more and more people are dying of fentanyl overdoses, even though they didn't know they were using fentanyl. And this has also affected the demographics and caused a big shift there in terms of what the overdose deaths were. Early on in the opioid overdose crisis, it was really more of a problem in our white population, not exclusively, but certainly majority. So in 2021, the overdose deaths in Black individuals increased from 112 deaths to 171 deaths, a 53% increase in 1 year. Overdose deaths in Black females increased from 27 in 2020 to 51 in 2021, almost doubling. So as a result, we've tried to sound the alarm on this and trying to do more outreach efforts into our Black community to make people aware. These are people who are not necessarily addicted to opioids, but they're dying of fentanyl overdoses, which is a very potent opioid. Also, a very recent report that came out, and another alarming statistic showing that law enforcement in the last quarter of 2020 had seized pills containing fentanyl, a 5,000% increase over previous quarters. So for this reason, we advocated for and succeeded in getting a new law passed this legislative session that would exempt from our drug paraphernalia law the distribution and possession of fentanyl test strips for the purpose of testing drugs before their use for the presence of fentanyl as another way to prevent overdose deaths. I want to thank our legislators and others who helped us advocate for this, including several of our law enforcement partners who again recognize that way too many people are dying and we needed to do something. This law will take effect on June 1st of this year. These fentanyl tests are fairly cheap. They're originally designed to test the urine for the presence of fentanyl, but they can be used by mixing a small amount of drug residue or a little tiny piece of a pill into water and then testing it before using whatever drug it happens to be. A study in Rhode Island showed that among people who detected fentanyl in their drugs using fentanyl test strips, 45% reported using less drug, 39% used with someone else present to make sure they were safe, 42% used the drug more slowly, and 10% discarded the drug and didn't use it at all. Another study in Greensboro, North Carolina, among people after fentanyl strip distribution efforts were underway. So this was a survey of people that had gotten the strips. 81% reporting using the strips to test their drugs, 63% reported detecting fentanyl in their drugs. People with a positive test were 5 times more likely to alter their drug use behavior compared to those with a negative result, including not using the drug, using less of the drug, or having naloxone on hand. So our health department will be starting to distribute this in June. We'll probably be adding it into the Narcan kits and also getting it out there with others. Our other harm reduction organizations can also do this because the test strips don't require a prescription or a medical provider to distribute them. So anybody can distribute them. Another big issue, which is a public health problem, is violence and homicide. One objective in our most recent strategic plan for the health department was to establish a strategy to address the problem of violence. In February 2019, I joined Mayor Woodfin in the Birmingham City Council in a news conference where we declared that gun violence in the city of Birmingham is a public health crisis. Our health department also facilitated development of the 2020-2024 Jefferson County Community Health Improvement Plan, or CHIP, which identified controlling gun violence and improving community safety as the #1 strategic issue for improving health in Jefferson County. Again, courtesy of our coroner's office, these are numbers of homicides per year that they investigated. There are other data sources, but I found this is one of the better ones. You can see that, again, homicides started to increase before the pandemic. They jumped up in 2015, but again, they really accelerated after the start of the pandemic. And this same trend exists in much of the country. Here's a distribution of the homicides by gender and race. You can see it's much more likely to be in males than females and much more likely to be in Black people than in other races or ethnicities. Homicide is the #1 cause of death for Black males aged 15 to 44 in Jefferson County. So it's a major concern, a major health equity concern for us. But the deaths are just the tip of the iceberg for the far-reaching negative impacts on families and communities. According to the CDC, and I quote, "There is also increasing evidence of the profoundly harmful effects of violence on child development, on long-term health of affected populations, as well as significant negative effects on the educational attainment, housing quality, and economic development of entire communities, especially communities of color." So for every person who dies, there are many others who survive gunshots, but nonetheless incur significant physical and mental and emotional trauma. In 2020 alone, UAB Hospital treated 666 Jefferson County residents for firearm-related injuries. Therein lies an opportunity. In March 2020, A community roundtable was established to address the growing need for violence reduction strategies in Jefferson County. The roundtable included representatives from our health department, UAB's trauma service, the City of Birmingham's Office of Peace and Policy, an organization called Moms Demand Action, Faith in Action, and others who shared the same goal to reduce gun violence and improve community safety in our local community. The roundtable held frequent meetings to identify programs that were evidence-based and had evidence of being effective, with some educational assistance from an organization called Every Town for Gun Safety. The roundtable eventually agreed to pursue the idea of a hospital-based violence intervention program, or HVIP. Upon the recommendations of members of the roundtable, JCDH contracted with another national organization called the Health Alliance for Violence Intervention, or HAVI. A lot of acronyms, sorry about that, to help explore feasibility of establishing a new HVIP, a hospital-based violence intervention program in Jefferson County. There are about 40 of these in the United States currently. And now, since then, we have determined with the help of this organization that it is indeed feasible. And so we're now contracting with them to go forward to provide technical assistance and training for a new program. This slide just shows the HAVI website in which there is a white paper with lots of information on the evidence base and the rationale for hospital-based violence intervention program. I want to just highlight a few of the key points from that white paper. Number one, violence is recurrent, as prior victimization increases the probability of repeated trauma, poor health, and death. Up to 41% of people hospitalized for violence return to the hospital with another violent injury within 5 years, and 20% ultimately died from violence. So again, a great opportunity here. Targeted intervention at the hospital and post-discharge level is an effective strategy to break the cycle of violence, reducing future victimization and violent behaviors. Hospital-based violence intervention programs reduce healthcare costs by decreasing recidivism to the emergency department and hospital, and reduces other societal costs by decreasing involvement in the justice system. The goals of the HVIP: number one, reduce subsequent acts of violence, improve physical and mental health outcomes, enhance educational attainment, and improve employability and employment status among the people that survive gun violence in the hospital. The HVIP will hire and train violence intervention specialists to engage survivors of gun violence before discharge from UAB Hospital Trauma Service. They'll find out what their immediate needs are for safety after discharge, and then engage them in 6 to 12 months of intensive case management and close follow-up. The violence intervention specialists are people who are representative of the communities who are affected by violence, who have lived experience and street creds. They will be hired, receive training from the hobby, and be managed by a community organization with technical assistance from the hobby. They will also hire supervisory staff and licensed social worker, who will then link survivors to various services and opportunities needed to help them recover and succeed. Our board, the Jefferson County Board of Health, approved $1.1 million in this year's budget for the health department to fully fund the first year of a new program through a grant through our Public Health Advised Fund at the local community foundation. Our intent is to continue funding in future years to maintain a program. We also requested and received a commitment for additional funding for years 2 and 3 of the program from the City of Birmingham for an extra $1 million per year using American Rescue Plan funds that they have received. We'll be making an announcement very soon as to which organization will receive the grant funding to run this program. And they will get started immediately with the hiring and training. And we hope to see violence intervention specialists in the hospital within the next 3 or 4 months. So just like the pandemic put a spotlight on mental health, The pandemic also put more of a spotlight on health disparities based on race, ethnicity, and income. Health equity has long been part of the discussion in the public health community at large and at our health department and among our local partners. In the 2014 Community Health Improvement Plan for Jefferson County, the number one strategic issue identified then was reducing health disparities associated with race, ethnicity, and economic status. The Jefferson County Health Action Partnership developed health equity trainings for community organizations. At JCDH, all of our managers attended their 2-day trainings a couple of years ago. The Health Action Partnership and JCDH have also developed health equity principles to help guide all of the work that we do. But what was new for many Americans, especially those who had not personally experienced racism, was that a veil was taken off racism when they saw the video of the George Floyd murder by police in May of 2020. Following this, several local governments in the United States, not so much in the South, but other parts of the United States, moved to declare racism as a public health crisis. Several corporations also pledged to do more to promote diversity, equity, and inclusion in their organizations. I asked our Board of Health at that time if they would be interested in making a similar declaration. On the one hand, we were already working to promote health equity. On the other hand, some felt there was a need to more explicitly name racism as an ongoing problem that affects people's health, and to not be silent on the issue during this time of national reckoning. The board took some time to discuss a potential resolution. There were a couple of concerns. One was that it wouldn't actually do anything that we were not already doing or planning to do as a health department. Another was that the mere mention of the word racism in Birmingham could raise alarms among businesses or people from the outside considering relocating in our area, that it would conjure up memories of police dogs and fire hoses and imply that Birmingham had not made much progress, not as much progress as it actually has. So after much discussion, the board did pass a resolution in February 2021 titled Racism as a Public Health Problem. It pointed to evidence in the public health literature that racism and racial biases do continue to have a negative impact on health. The resolution pointed out that there is a legacy of racial discriminatory policies and actions which have had a long-term impact on social determinants of health and resulting health disparities. But it also made it clear that this is not at all unique to Birmingham and Jefferson County. It also focused on the positive, that Birmingham and Jefferson County have embraced and celebrated the legacy of many local citizens who played a pivotal role in the civil rights movement and have in many ways taken steps to confront and mitigate the vestiges of racial discrimination, positioning itself to further advance the cause of racial injustice and equity, including health equity. Our health department is now moving to require diversity and health equity training for all of its 450 employees. And we are in the process of establishing a new Office of Health Equity to help ensure that we're actually following our own health equity principles and continuing to promote health equity in all that we do. So finally, as is our tradition, I want to give out this year's Public Health Champion Award. During each Public Health Week, JCDH gives out a Public Health Champion Award to a local organization that is not usually a regular public health agency or health care organization, but nonetheless does good work in promoting health in our community. This year, I'm going to make an exception to that rule. This year's award goes to our local hospitals and their staff. So there are a lot of awards we're going to have this year. I was on regular calls with the CEOs of our local hospitals as they coordinated their efforts during the several pandemic surges to preserve PPE and other resources that were in short supply, to establish policies to protect their patients and the workforce, to provide testing and later vaccinations. They all stepped up in major ways and at great sacrifice to save many, many lives in our community. I have a huge amount of admiration for our hospitals and the people that work there, as well as gratitude for their work. Is Jeremy Clark here? Jeremy, would you come down, please? Jeremy Clark, who's CEO of Brookwood Baptist and Vice Chair of our Birmingham Regional Council of the Alabama Hospital Association, is here to accept the award on behalf of our local hospitals. And it's a nice looking award.
Fantastic.
Kind of heavy. Here it is right here. Public Health Champion for honor for heroic work during the COVID-19 pandemic. And this particular one is presented to Brookwood Baptist Medical Center, but we have one for each of our hospitals.
Great.
So thank you so much.
Thank you so much.
You can make a couple remarks if you want to.
Well, I'll say thank you for this. And this really goes to all of our employees, our nurses, physicians, all of the techs at Brookwood Baptist and in all of the hospitals across the county. The last 2 years have been incredibly challenging, but also incredibly rewarding to work with those individuals and see them continue to provide high quality care, but also create and now maintain a safe environment of care for everyone who's receiving care in our building. So thank you very much for this.
Again, we're very grateful.
Thank you.
So that concludes my remarks. I do think we're going to accept a few questions if anybody has any or comments.
So regarding the fentanyl overdose, do most people who overdose from fentanyl here in Jefferson County know they're taking fentanyl, know that fentanyl is in the drug?
Yeah, I don't know the exact numbers, but the big concern here lately has been the number of people that do not know. I mean, they're cocaine users. They're we've even seen it in some marijuana. And one really big concern is the pills. We have college students who take Adderall to stay awake to study. If we don't know the source of those, they could die of a fentanyl overdose. So we're really concerned. Now, some people do know that it has fentanyl, and some people who have a very high level of dependence on opioids actually might want fentanyl because it's so much more potent, and they're not getting the same high or the same effect as they used to from something weaker. But I don't know the actual numbers.
We're hearing a lot now on COVID, not to belabor that it's changing from a pandemic to an endemic. What are your thoughts on that?
I don't have a lot of thoughts on that. I mean, it's to me, it's a little bit of a semantic thing, but I'm very reluctant to predict the future. It's been very interesting to just look at our numbers. I mean, right now, even though this BA2 variant is becoming the predominant variant, we aren't seeing our numbers budge at all. They're still staying quite low. Our percent positivity is still down around 2%. So, I mean, there's still cases popping up, and I wouldn't be surprised if we have a little mini surge maybe. But it's just interesting to watch. We know that immunity wears off. So I suspect as long as the virus is around, we'll see people continuing to get cases, perhaps similar to the way, we get cases of the flu, and we're going to have to vaccinate every year or however often to try to keep it under control and keep people safe. All right. Thank you very much.
Thank you, Dr. Wilson.